Good day. My name is Michelle Lavander. I'm the
Mhm.
director of the USC Center for Health Journalism. Thanks for joining us today for our Health Matters webinar with Project 2025, Herald the End of Health Policy as We Know It. By now, you've heard of Project 2025, a conservative blueprint for a new administration that has increasingly peppered news coverage and Democratic campaign speeches. The 900-page plan from the Heritage Foundation, a right-wing think tank, seeks to drastically curb the role of the federal government in American life or abolish the deep state, as its authors put it. That includes proposals to eliminate entire federal agencies, to gut LGBTQ health programs, clamp down on reproductive care, and to shrink drastically the nation's social safety net. The plan advocates capping spending for Medicaid, the nation's health program for low-income people, and for privatizing Medicare, the federal health insurance for people 65 or older. Trump has publicly distanced himself from Project 2025, but CNN found that more than 140 people who've worked for the former president helped to craft it. So is the manifesto a Trump governing manual in waiting, or are Democrats using it to engage in fear-mongering at Republicans' expense? And more importantly, how does the plan fit into the larger universe of conservative proposals that would upend the role of the federal government as we know it should Trump gain a second term? In our webinar today, our distinguished panel will help us decipher Trump's positions, likely governing scenarios the second time around, and how journalists can cover the state of affairs in health policy in this shifting landscape. Let me introduce our panelists. Drew Altman is President and Chief Executive Officer of KFF, a position he's held since founding the organization in the 1990s. He's a leading expert on national health policy and an innovator in the nonprofit field. He is founding publisher of KFF Health News, the largest health newsroom in the US. Prior to KFF, Drew had a distinguished government and philanthropy career and has been recognized for his work on welfare reform, school-based health, community-based HIV health services, and homelessness. He's a member of the National Academy of Medicine and the Council on Foreign Relations. Sarah Overmall is a Washington correspondent at STAT, reporting on the Biden administration's health goals, federal health policy, and politics. She previously covered health policy in the drug industry for Politico and SAP Global Market Intelligence. Before that, she spent 5 years in Dubai and Beirut, reporting on business, finance, and development in the Middle East and Africa. Victoria Knight is a healthcare reporter for Axios, where she focuses on congressional health policy, including abortion, drug pricing, and Medicare. She previously was a reporter for KFF Health News, where she covered health policy debates in the 2020 presidential election and the COVID pandemic response. This webinar is made possible thanks to the generous support of the Commonwealth Fund, the National Institute for Healthcare Management Foundation, and the California Endowment. We'll be archiving this conversation later today at centerforhealthjournalism.org. A word about our format today. We'll be having our conversation with our panelists first, and then we'll turn it over to our audience for questions. Because we have many people joining us on Zoom, we'll ask you to write your questions for our speakers into the Q&A panel. You also can write us there if you're experiencing technical problems. Now let's get underway. Sarah, please provide us with some context on Project 2025 and health policy. Help us understand the connections between what's advocated in the Project 2025 report, despite the former president's public disavowals of having anything to do with it. For instance, how do we figure out Trump's positions on issues such as LGBTQ and reproductive health policy, as well as Medicare, Medicaid, and public health, amid the confusion of competing statements and Trump's own seeming disinterest around policy details?
Yeah, first of all, thank you for having me. And I know that it's a very big question, so I'm going to do some scene setting that I'm sure the three of us will get into more here. I think we'll go through sort of the things that you mentioned, what Project 2025 says about those, and what Trump has said or not said about those things. So Michelle, as you already alluded to, he's tried to distance himself from this project. He's called it, quote, seriously extreme. On his social media site, Truth Social, he said, I know nothing about Project 2025, and quote, I have no idea who is behind it. As you said, many of the people who are behind it are former Trump officials. The main author of the healthcare section, Roger Severino, headed up the Office of Civil Rights at HHS during the first Trump administration. So he does have familiarity with a lot of these people. but he has sought to distance himself from a lot of these policies, although not all. So we'll start with reproductive rights, since that, as you said, the DNC 4-day event, Kamala Harris, Tim Walz have all talked extensively about what a new Trump administration would look like for reproductive rights and abortion in particular. So going into, what Project 2025 actually says about it. So you might have heard Harris and Walz say that, it would establish a abortion coordinator. It's somewhat that. I'm referring to my notes to get the exact wording here, but it would be a, quote, pro-life, politically appointed senior coordinator of the Office of Women, Children, and Families. They would also appoint a quote, unapologetically pro-life person in the USAID to track reproductive care messaging and abortion services, even though the federal government is not allowed to provide abortion services under federal funding with USAID. It would also have the CDC track abortions, the method used by them, the state that a woman came from. So if she traveled to another state with fewer restrictions, it would have CDC more closely track those things. And it would, quote, use every available tool, including the cutting of funds, to ensure that every state reports exactly how many abortions take place within its borders, at what gestational age of the child, for what reason, the mother's state of residence, and by what method. So President Trump, as we said, has called this whole 900-page document, quote, seriously extreme. What he has said on abortion and reproductive rights, he's really leaned back on constantly saying this is a states' rights issue, that the Supreme Court turned this back to states and that the decisions are up to them for what they do. What's interesting about this in practice is sometimes states have gone pretty far. For instance, Arizona's very restrictive law, which he has called, going too far. So he says it's a states' rights issue unless it's a state law that he does not agree with. But he has also said that he has supported the Supreme Court decision leaving access to the abortion pill mifepristone unlimited for now, which means that it can still be sent through the mail. He has also said more recently that he would not invoke the Comstock Act to restrict mail order abortion pills. That is a very old law that would potentially, it's been said that by some conservatives that could be resurrected to restrict mifepristone access. He also has said that he would not limit intra vitro fertilization, or IVF. That's another thing that Democrats have brought up pretty extensively at DNC and other rally events. He has said he would not restrict that. But he has not talked about some of those other details that I mentioned, like the CDC setting up a tracking system to more comprehensively see how abortions are being done, who's traveling out of state, and the potential repercussions that obviously that data would have for people who are seeking abortions. So moving on, and I know I'm breezing through things, but I want to give time to everybody to talk about this. But moving on to LGBTQ rights and gender-affirming care, this is one area where Trump has been more specific. In the Republican National Committee platform, he has said that he would want to bar federal funding for all gender-affirming care, regardless of age. Now, 22 states have already enacted gender-affirming care restrictions, largely focused on minors. Some states have gone even further. Florida has enacted requirements for in-person meetings with physicians, not just nurse practitioners, that makes it harder for even adults seeking gender-affirming care to maintain their care or to start their care. The Project 2025 goes extensively into how it wants to roll back protections on gender identity and sexual orientation, whether in the workplace, whether in discriminatory settings, and in healthcare. It also wants to abolish the Gender Policy Council, which it says would abolish the promotion of abortion and of gender-affirming care, or transgenderism, as it talks about in that document. So this is one example of where Trump has been a little bit more precise with what he wants to do. But he has not referred to the Project 2025 platform in doing that. But it really is, it's become somewhat of a tenet of the conservative platform to roll back gender-affirming care protections and discussion of gender identity in schools, in healthcare areas, and workplaces. You mentioned Medicaid and Medicare, and I know that we're going to get into this with the other speakers more as well. With Medicaid, the Project 2025 platform talks about reverting to block grants, which would be flat funding for states. It would be potentially a cost saver for the federal government, but would have issues as far as the changes that happen in Medicaid, the changes in enrollment, the changes in populations of states, the changes in benefits. With Medicare, there's a similar look at saving money. So in the Project 2025 document, it says, quote, in essence, our deficit problem is a Medicare and Medicaid problem. And so it goes into some of the ways that they would do that, but not all of them. One of the ways in Medicare that they would do that is by making Medicare Advantage, which is the private insurer option for Medicare, the default option. So people would not be enrolled in the government program, but in what private insurers offer. It doesn't go into much more detail about what they would do. And Trump himself has not gone into much more detail. He hasn't talked about Medicaid at all this time around. With Medicare, he has simply promised, quote, not to cut one penny. We don't know if that means, it certainly leaves the door open to changing a benefit structure, or as Project 2025 suggests, rolling back or repealing, I should say, the Inflation Reduction Act, which allows for direct negotiation of drug prices and implements an out-of-pocket cost cap for seniors. Project 2025 pretty explicitly says that they want that law repealed. Trump has not gone that far in his own public statements. He's simply said that he won't cut a penny from Medicare. And you can see why he would say that and not go into details. Obviously, senior voters would raise alarm bells to see that there could be changes to their benefit plans. But Project 2025 pretty much lays out how it would do that and says that there's a deficit problem because of these two programs. And then finally, just one more thing that we didn't really, you mentioned public health. I think another interesting thing that isn't gone into as explicitly in Project 2025, but is something we've seen brewing on the Hill and with comments from President Trump, is how the public health structure and specifically the National Institutes of Health would change under a second Trump administration. So in Congress, among House Republicans specifically, there's been a lot of talk of completely overhauling NIH, merging some institutes, erasing some entirely, changing the funding structure, and implementing new limits on people being leaders of the institutes. This is something that's seen as sort of a response to Anthony Fauci being the leader of the National Institute of Infectious Diseases or Allergy and Infectious Diseases for many years, and restrictions on the type of research that can be done. So certain pathogen research, and then also barring fetal tissue research, going back to that idea of Roger Severino being a very anti-abortion figure and being one of the lead authors of this document. And so that's something that isn't as laid out in Project 2025, but it's definitely an interest of Trump and of some Republicans in Congress as well. So I think that we could see, and even just as I laid out with some of the things that they would require from CDC, we could see a lot of scrutiny on the way that NIH and CDC operate, the data that they are allowed to share, the data that they will then be required to share. I neglected to mention when we were talking about gender-affirming care that the opposite of what would be happening with the abortion data, where they want comprehensive data on who is having abortions and how and why. They would do the opposite on gender identity. They actually would want to abolish the gender surveys that CDC does. And so there could be a lot of changes coming on that front as well. I know that I just flew through a lot of different things here, and I know we're going to talk about them more in detail, but I think it's interesting what President Trump has engaged with on this and what he has left the door open to. And it's reflective of how he feels voters are. So he's been talking a lot more about abortion and reproductive rights, because we know that polls reflect that voters are very scared about these issues. They don't want to see national restrictions. So he's engaged more with that topic than he has with the other ones at this time. Oh, Michelle, you're muted.
Muted.
Sorry about that. Thank you so much for this great scene setter. Drew, let's turn to you now. A lot has been said about what Republicans hope to achieve under a Trump administration, not just by the Heritage Foundation and Project 2025, but also by other conservative think tanks such as Agenda 47 and congressional committees. So help us cut through some of this noise. What might realistically happen on healthcare policy if Trump wins? And what policy fronts have Trump and his allies been conspicuously silent on for strategic reasons for which change could be in the works?
Okay. Sarah, that was the best summary I've ever heard. That was Awesome. I want to hear your views on the Middle East, though, if you can do that in like 5 minutes. One time when I was in government, the New York Times actually described me as a nice guy trapped in a deadly serious space. So when Michelle asked me to do this, I was thrilled to do it. It's just there's no way that you can tell that I'm thrilled to do it. My job is to talk about what actually might happen if Trump is president and why it might happen. It's the kind of assignment I admit you get when you've been in the field for 500 years and you're willing to say things that other people might not be willing to say. And possibly now you will never have a chance to know whether anything I predict will come to pass or not. We'll see how the election comes out. I do want to ask you whether any of you have seen the movie Civil War. It's a contemporary Civil War told through the eyes of three journalists. It's kind of a yucky movie, but a Trump-like president claims a third term, and the country is redeemed in a penultimate battle at the White House by, wait for it, the combined forces of California and Texas. So it's very plausible. Assuming that does not happen, okay, and we're dealing with something resembling regular business in the country. First, every instinct that I have and all of my experience tells me that there will be a major assault on the Medicaid program, possibly also including, it could be separate, but more likely in a single large package, parts of the ACA, like diluting some of the coverage provisions and diluting, not eliminating, the protections for people with pre-existing conditions, all of which is what Trump calls making the ACA better. Those are his words for that. I should start by saying that the Medicaid program is no pushover, not even close to that. For those of you who don't, live it and breathe it like we do at KFF, it covers 82 million Americans, down from over 90 million Americans. It's also the single largest source of federal funding for the states. So that is not something that is to be trifled with. It's the primary source of coverage for long-term care, insurance coverage, and for people with disabilities. Those are very powerful lobbies at the state level. Half the babies delivered in most states are covered by the Medicaid program. And actually, it's not as popular as Social Security and Medicare. It's not well known, but in all of our surveys for years and years, it's not far behind. And people are almost as resistant to cutting it as cutting Medicare and Social Security. But there are several forces that I believe will conspire to make it the main target. First of all, Republicans are not going to want to cut, forget what Trump said, Social Security and Medicare, because as soon as the election's over, it's the midterms start to loom, and they're just not going to want to give the Democrats a powerful issue to hit them over the head with for the midterms. And there are proposals in the right-leaning think tanks, as was alluded to convert Medicare again to a voucher-like or premium support program. I don't think they will go there for exactly that reason. And even if they do, but especially if they don't, the Republicans are going to, in Washington, are going to desperately need savings to pay for their tax cuts. And the only other big program left is the Medicaid program. They also don't like the Medicaid program. They see it as a program that primarily serves, and they always have, Democratic voters. By the way, there are about, my calculations, 20 million Republicans on Medicaid. More importantly, they see it largely as a form of welfare assistance, kind of just like cash assistance. They don't see it as health insurance coverage. And that's kind of fundamental, because when you see it that way, you are more comfortable with, you might even want to cut it, to impose requirements like work requirements to get it. If you see it instead as insurance coverage and part of a continuum of coverage in our country, you're more likely to want to protect it. You're much more likely to want to expand it. There are these fundamentally different, I just wrote one of my columns on this, worldviews about the Medicaid program. And finally, and I think importantly, Republicans have a still big, unfulfilled, but very strong ideological agenda here, which is to reduce the role of the federal government in health, and related to that, to reduce federal spending in health as well. So all of these forces are going to converge like, I don't know how many of you are Civil War buffs, but like Pickett's charge on the Union lines and at Gettysburg. And I think they will meet the same fate, a near thing with a retreat, but it will be after a big battle, and it depends on a number of other things what happens. So yes, Trump has said, he won't touch Social Security or Medicare. But to some of us, his silence on Medicaid is the loudest thing he said. It's actually deafening. And among the proposals developed by Trump-affiliated groups, the Republican Study Committee, which is a very conservative group in the Congress, has proposed a series of complicated block grants that lump together all of the ACA coverage provisions and all of the Medicaid program, and their estimate, not mine, would reduce federal spending on low-income coverage by $4.5 trillion over a 10-year period. So you just can't do that without decimating coverage for low-income people. 2025 has proposed, I believe they proposed a 3-year, but certainly time limits on how long people can get Medicaid coverage. Because again, they think of it like cash assistance. You shouldn't get in their mind cash assistance forever. The Paragon group, another group, has proposed incentives to end the Medicaid expansion and a disincentive to continue the Medicaid expansion if you're a state that has it. So it's really not all about 2025. And the Democrats have been very successful in making 2025 a symbol. That's a political strategy. I actually don't believe the media should buy into that in quite the same way, because it's a set of groups that are all in the Trump orbit, all of whom have leaders who would wind up in a Trump administration. Obviously, and we'll hear about this, what happens in Congress will determine the scope of what they can do. A Democratic House or a Democratic Senate will block the most draconian action, but a fair amount can be done by CMS through waivers, which will be controversial and which will end up in court challenges. And so Michelle Council needs to explain what the hell is a waiver to those of you who don't live with this stuff. So a waiver, which you will hear referred to as a Medicaid Section 1115 waiver, is basically permission granted by CMS or the federal government to states to do stuff differently under the Medicaid program. Not anything. There are rules and regulations. And I, unfortunately, have an advanced degree in waivers because I gave them when I worked in HCFA before it was CMS. I was asked to run CMS by first President Bush. I got them when I was a state commissioner of human services. And just to underscore a point about them, the biggest waiver I got, and one of the biggest, was for our state welfare reform program. And we got it in the White House at 2:30 in the morning when we threatened the White House that we would denounce their efforts to squash then the leading Republican welfare reform initiative, which was set to go live just a few hours later if they didn't approve the waiver. The governor was asleep. It was entirely a bluff. He would not have done that. And they approved the waiver. The point isn't the story. The point is the waiver process can be technical, but it's also often very political. And it would be no matter who is president. So watch for waivers on time limits, on work requirements currently in place only in Georgia, and more. I don't know for sure how this will play out, but my guess is they will fail at the really big changes they have tried before, and we will end up in waiver land with lots of big debates about waivers. Just a couple other things. The other big debate will be about abortion, which has been mentioned. Should it reach him? I, for one, do see Trump signing a national ban with the 3 exceptions for rape, incest, and the life of the mother, but painting himself in doing that strangely as the moderate, as the mediator, which is what he did at the BJ. And that as his excuse for backtracking and signing it. But it's very hard to predict. Others see him, as was mentioned, reversing the FDA approval or stopping distribution of mifepristone. Trump-Vance have said all kinds of things on abortion. I think it's very hard to predict what they will do, but that's my prediction depending on what happens in the Congress. I also think abortion is illustrative of something we will see generally and could lead to a lot of stories. It's kind of obvious, but important to say, which is the red states and the blue states will be moving in totally different directions, kind of like what you saw in COVID, but I think a much more extreme version of that. And I wouldn't get carried away with how much the blue states can do, no matter how earnest and ambitious they are, without federal funding and federal approval. They can do some stuff. I always had a hard time with, we are going to do a state single payer proposal. And I would say, really? Without Medicare and Medicaid, which you need federal, can you do a single? So you need the feds to do a lot. And then finally, lastly, there's a third kind of challenge, which was also, I think, smartly mentioned, and that's all the problems they won't be addressing and all the backtracking they will be doing on consumer protection, on industry consolidation, importantly on health equity, which has been a big focus in recent years, which they will call DEI. The only area which is a possible exception and also hard to predict is drug prices, where Trump made a lot of noise about drug prices, and it's just very hard to know what he would do about drug prices. And so that's really something to keep your eye on. And the things they don't do may be more important than the things they do. And there'll be tons of stories there and lots of people's stories there. Having started and overseen our newsroom forever, I also have on my mind a million challenges for journalism, but that's another subject, and maybe we'll get into it in the Q&A. And again, maybe you won't have a chance to see whether any of these predictions come true. Thank you.
Drew, thank you for walking us through all these insights. Really very valuable. Victoria, there are dreams and plans, and then there's the reality of governance. And in realizing a Republican agenda, so much depends on whether the GOP gains control of both the House and Senate. Given that uncertainty and your own deep experience as a congressional health policy reporter, help us understand how some of these policies we're discussing might play out on the Hill. And we talked about this a little with Drew, but what can be done, for instance, through executive orders, and what parts of the Republican vision would involve working with Congress and through key agencies like Health and Human Services. Another way to think about this, what's the maximum and minimum that a Trump administration might be able to accomplish?
And echoing everyone else, thank you so much for having me. So I've actually been a congressional reporter, health reporter for a couple years, but already you can kind of figure out how the place works. So what I will say is it's really up in the air what's going to happen with this election. I think no one can really predict. The traditional wisdom for this election has been that Republicans will take the Senate, but the House is more up in the air. I'm not sure if that really will change now with Harris as the presidential nominee. The key to that is that Senator Joe Manchin is retiring. He's a moderate Dem from West Virginia in what is a pretty Republican state. So that seat is basically guaranteed to be Republican when it was Democrat. And then there's some other really close races in the Senate. The House, is its own thing. It's had a lot of turmoil under this Republican majority. They have a very slim majority, only a few seats of majority, which has caused a lot of issues. If you've been following it at all, Kevin McCarthy was the speaker, but it took 15 rounds to make him speaker. Then he was ousted. Then the House didn't have a speaker for 3 weeks, and now they do. But they still have issues with the Freedom Caucus trying to, make things hard for them often, and when they're just trying to get past spending bills and things like that. So people had been like, well, this Republican House has been so chaotic. Well, are people tired of it? But I think it's unclear also, there's a lot of talk of maybe people just voting down the ballot. And if they really want Trump as president, they may just vote Republican all the way down. So that's all to say, unclear what will happen. But in the event there is a Republican trifecta, so a Republican president and majorities in the House and Senate, there is already talk of using reconciliation. So this is a type of legislation that it's basically a way to fast track bills. It can only pertain to spending revenues or the federal debt limit. So only certain types of things can be done via reconciliation. But it is what the Democrats used to pass the Inflation Reduction Act during President Biden's first 2 years in power, and when Democrats had the majority in the House and Senate. So they, obviously they were able to pass Medicare drug price negotiations and an insulin price cap for seniors using this process. So Republicans have, seen what Democrats were able to do and are already trying to plan. I've talked to staffers, lobbyists, experts. They're already talking about how could Republicans use reconciliation for their own health goals, and particularly they're thinking about taxes, I will say, but healthcare is definitely something that they're considering using reconciliation for as well. And one other thing is that reconciliation can be much more easily passed than other legislation because you do not need to clear the filibuster, which is 60 votes in the Senate. You just need a majority. So that's how it can get done. You don't need the votes from the other party in the Senate to get it passed. So the things that Republicans are kind of talking about for reconciliation that I've heard, obviously this could change a lot, but and there I will talk about in a second kind of the issues with the tax bill and the ACA subsidies that will be a big issue next year, most likely. But basically, Republicans will need to pay for some things. So things that they're thinking about are site neutral payments, which is a policy that would equalize payments for services, whether it's provided in a hospital outpatient department or an independent physician office. Right now, Medicare pays different things depending on where a service is provided sometimes. And that's a big saver if they implement this equalizing the payments between the service sites. So that could help pay for different things. There's also talk of cracking down on Medicare Advantage overpayments to insurers. And there's also talks, as both Sarah and Drew have hit on, of changing the Medicaid program. So potentially program cuts. Unclear exactly what that look like because there's a lot of policies out there. Could be caps on Medicaid spending, could be block grants, could be work requirements. So that's up in the air. But those kind of the three things that I've heard from the sources that I talked to. So that's kind of for a GOP sweep. If there's a split Congress where Democrats have control of one chamber and Republicans the other chamber, there is a lot of talk of these expiring tax cuts. So Trump passed the 2017 Tax Cut and Jobs Act, or under him, that bill was passed in 2017. It put in place a lot of tax cuts. So those are expiring the end of 2025. The ACA enhanced subsidies that were enacted with the IRA, those are expiring at the end of 2025. So there's already a lot of buzz around the possibility of, if there's a split Congress, kind of swapping those policies. So Democrats get what they want, which are extending the enhanced subsidies, which have allowed a lot more people to access ACA health insurance at a pretty low premium. And then Republicans will get what they want, which are extending these Trump tax cuts. So that would require obviously a lot of negotiation and to make that a reality, but it is seemingly a possibility that a lot of people are talking about at this point. I will say if Republicans do sweep, they also will most likely not be extending those ACA enhanced subsidies. They right now, do view those as kind of going to people, sometimes going to people that they think maybe could pay for the coverage themselves. Incentivizing fraud is a big thing that they've talked about, of potentially people signing up that they think are ineligible for these and getting insurance for a really low price that really aren't eligible. There's been a lot of oversight of that. And then also, there's been kind of talking of that this is just giving money to insurers, to health insurers, and they don't want to keep doing that. So I do think if there's a Republican sweep, those will go out the window. And so that's kind of from the congressional aspect. Also, there's a lot of talk from Democrats that, especially I noticed during the DNC, of saying Trump would repeal the ACA. I will say on the Hill, I don't know if there's a huge appetite for that again. People are very burned by that experience in 2017, staffers and lawmakers. When you talk to them, they are scared of having to go through something like that again. And also the ACA has become even more ingrained within our system than it was back in 2017. So But obviously that could change if Trump prioritized that. So I think if Trump pushed for it, then, the Hill would maybe muscle up and have to do it. So we'll see. Obviously Trump has been a little bit all over the place with his statements on ACA during this presidential election cycle, saying he would repeal it, then saying he would improve it. So that's up in the air. But and I think another thing to remember that Senators Lisa Murkowski and Senators Susan Collins, they are moderate Republicans from Alaska and Maine. They voted against repealing the ACA in 2017, and they are still in Congress. And so also, it will depend a lot on what the majorities are. So if the House has a slim majority and has some moderate Republicans that don't want to repeal the ACA, and then the Senate has a slim majority of Republicans, like it may also not be feasible. So a lot is dependent, but we'll see. I think kind of the same goes for IRA repeal. There's some talk of potentially repealing IRA's Medicare drug price negotiations. Obviously, Republicans really oppose those. They say that pharmaceutical companies, it's hurting their innovation and their research and the ability to produce new life-saving drugs. I think that's another thing. Trump hasn't really spoken publicly on his stance on that. And he does, for one of his really big healthcare things has been drug prices. It's if you look at Agenda 47 on his website, that's one of the few things he talks about with healthcare, particularly the most favored nation policy. But would he want the optics of repealing the Medicare drug price negotiations? I'm not sure. And JD Vance, unclear how much power he'll have as a VP, but he does support Medicare drug price negotiations, or at least he said so in 2022 when he was running for Senate. So I think IRA repeal is also up in the air, but if Trump prioritized that, then it's a possibility for sure. I think both Drew and Sarah have hit kind of like what you could do from the executive branch, but I will say there is the possibility, like I think you'll notice Biden during the last year and a half, I guess, when it's been a split Congress, he has tried to use the executive branch to kind of protect access to abortion and also protect access to gender-affirming care through taking measures through the agencies. I think you could see Trump do that same thing if there's a split Congress, but with restricting access to abortion or restricting access to gender-affirming care through using the agencies. Drew talked about the possibility of a national abortion ban. I will say there are a lot of anti-abortion Republicans in Congress, particularly House Speaker Mike Johnson has been very vocally anti-abortion basically his whole congressional career. And so I think it's a possibility. It's not something Republicans really want to talk about right now. There are anti-abortion groups that are really pushing for this as well. So again, I'm not sure how that might go down, but Trump has, though, been very vocal about wanting on his, if you look at his campaign platform website, doing a national ban on gender-affirming care, particularly for minors. On his website, it does say that he would do that. He would vote for that. JD Vance also has introduced a bill that would basically ban gender-affirming care for minors as well. So I think that's highly a possibility. That's clearly been a topic within states, especially. There's been a lot of action. I think Sarah said 22 states. But there's been a lot of talk among congressional Republicans about this as well. So I think it is something you could see having action in Congress. Again, depends on the majorities. A lot is up in the air, but those are kind of scenarios. I think I'm up on time, but I'm happy to answer other Congress questions to the best of my ability.
Yeah, and just adding on what you said about gender-affirming care and congressional Republicans, they did try to insert that language into appropriations bills last year, right? And yeah, so the effort has been made already, yes.
Well, thank you so much, Victoria. I just want to ask a question for all of you, but meantime, just want to mention that we're going to be turning shortly to the questions from the audience. So if you do have a question, please add it to the Q&A in the Zoom. So just wanting to get everybody's take on what journalists should be thinking about and strategizing about, both on a on a local level, on a state level, and a national level right now, and also a few months from now when all this will obviously be clearer?
I think I'll start with one that seems fair. My cat is coming. Sorry. No. Um, that seems maybe perhaps a bit obvious, but since this is something that we have already been talking about so extensively, is just no. Apologies. Just how this messaging about Project 2025 is actually resonating with voters at the local or state level, if it is at all, because as we talked about, this has really been weaponized by Democrats seeking to say, like, these are the extremes that he's willing to go to on abortion, on ACA, and then, you know, Trump has gone back on some of those, but very few voters are going to sit there and open that 900-page document and see what it actually says and then compare to what Trump has said. So I think it'd be interesting for state and local reporters to see if whether this is resonating at all with people who are undecided or people who didn't think this was an issue for them, but now they're changing their minds.
Yeah. And Drew, what would you be doing? What are you telling your KFF newsroom to be thinking about? Not that you would ever do that.
No, we talk about story ideas and they do what they want. The well, concretely, I'd like to see a lot more stories on how the state abortion restrictions actually work out for people, but particularly the exceptions. Since Trump has talked a lot about that, and the exceptions don't actually work. We just, not the newsroom, but we just produced an analysis of that. There's so much more work that could be done about the three exceptions and how they actually are working around the country in the states that have them. The bigger issue that I'm concerned about, not exactly your question, but not too far from it, is that the big trend right now and the thing where many of us are involved in is the local journalism filling the news deserts. Virtuous and badly needed, and we're part of it, and we're part of Press Forward. But from a health policy perspective, actually what matters more is what happens in state capitals and what states do. And it's equally a news desert. When I was state secretary, my department was a third of the state budget workforce. I was followed around every day by maybe 20 reporters. It was an unbelievable, drove me crazy, and it was an unbelievable public service. It's all gone. And so it's the decisions that are made about Medicaid and about abortion restrictions that we've been talking about today that matter most of all for the most people, not what happens in the local hospital boardroom. And I think there's a sweet spot, which is how those decisions play out and affect people locally. You can bring together what's happening at the state level with how it matters locally. But I am concerned in the incredibly important focus on local journalism that we're forgetting about something that for health policy is more important. And so that's an issue I wanted to raise.
And Sarah, did you want to add anything here?
Wait, sorry, my cat was coming back over, so I was a little bit distracted. But no, I think
journalism angles and to follow up on what Drew was saying, I mean, how much of the action is really going to be defined by the states? There's so much focus on the rhetoric on a federal level, but
I mean, completely agree that a lot of the action will be defined by the states and already has been, whether it's abortion and as Drew said, there is a lot of talk about exceptions and how they work in practice, and we've done some work on stat about those questions, and there's already been some court cases that seek to push those questions. For instance, Idaho's near total abortion ban was before the Supreme Court earlier this year because of the question of when is something life-threatening enough to provide that abortion to that woman and then protect the healthcare practitioners who provide that abortion. And in Idaho, they've already airlifted several people out of the state to get abortions to avoid that question. And so this exceptions thing is not going away at all. And I think it's going to get fleshed out on the state level more. And then as both Victoria and I have mentioned already, we're seeing the question of gender affirming care, how it's talked about in schools, gender identity in general, is already half of states are wrestling with that right now. One thing that's interesting is that while we have 8 states that have abortion referendums on the ballots this fall, for the most part, gender affirming care bans or restrictions have gone through supermajority state legislatures. So where there's so many Republicans that even if there's a Democratic governor, for instance, in Kentucky, they can override a veto. So we haven't really seen it given to the voters yet on the question of gender. So we could see that in the coming years as well, especially if President Trump does get into office and starts to enact federal bans, the responses that we'll see from states.
On a related issue, one thing we have seen clearly in our polling, our state polling, is that the ballot initiatives really do have an impact on enthusiasm, particularly for women, especially for Democratic women, but for women generally. And it's interesting, much more in, say, Arizona and Nevada than in Michigan, where the voters feel they settled that issue with their referenda a few years ago. So, I mean, for some of you, that's a story idea as well.
And Victoria, I wanted to make sure to turn to you for your ideas for reporters.
Yeah, I mean, I think that I guess there's a lot of local people on here. I think like hearing the real life people's voices is so important. I get to only talk to lawmakers, and I miss talking to real people. But I would say, I mean, I think it's interesting because there's been so much talk from Dems on healthcare and how they would keep going past like what was passed with the IRA. They kind of want to build on that. That's kind of their big platform. Does that resonate? I'm like, if you look at polling, like a lot of people don't even know that IRA, the things that were in the IRA are about to be in place or that they were even passed. I'm just curious, like, are people aware of these things? Like, what does healthcare like mean for them in this election? That's what I would be most interested in. And also, I think Drew wrote a really good column, I think it was last week, about just the shift of like, obviously the ACA, particularly the enhanced subsidies, have really helped increase coverage. But just because people are covered doesn't mean it's affordable still. Even with these enhanced subsidies, or even just in general, healthcare costs are still really high. People still struggle with those. I think that's partially why you've seen, presidential nominee Kamala Harris talk about medical debt somewhat in as part of her platform. Yeah, I'm like, do these things resonate with voters if they still can't just afford healthcare cost?
If I can jump in on medical debt, I know we have lots of people questioning with great questions, so I don't want to be too long on this, but you raised a great point there, and I think actually a really pertinent one for state reporters. The medical debt question, while it, of course, would be popular with voters, who doesn't want medical debt erased? In practice, getting that done actually would take a lot of state involvement, state government involvement, and involvement from the hospitals themselves. And so there's a lot of potentially juicy stories there in how medical debt would get erased and who's getting the payout and who's paying for it. The federal government, obviously, but like this could very well be a boon for hospitals because they're going to get their debts paid by the federal government. So how is this going to work in practice? What states are game for it and how it's going to work, with hospitals, I think is a really interesting story too.
Thank you so much, Sarah. I'm going to turn to our questions from the audience. I'm going to start out with one from Michael Cousineau, who asks, what will happen to the CDC and other federal public health functions like disease control?
I can kick that off, but I think Victoria too would have insight on just how it's been going in the House with budget. There's a lot of, Trump has not talked in detail about what he would like to do, except for criticism of how the CDC was during the coronavirus pandemic and what he saw as alarmist behavior or language or overextending CDC authority with things like mask recommendations, vaccine recommendations. So he obviously wants to see that sort of roped back, but then there's the aspect of funding. And so in Congress, Republicans are recommending flat funding for a lot of different programs, then actually erasing some programs entirely. One of them is being a surveillance system for different pathogens. And a lot of caps on kind of like HIV spending and a lot of public health things like that. Another aspect of it is sexual health, of course. So I talked about how separately, they would want to remove CDC surveys on gender identity. So we just wouldn't have that picture anymore of any sentiment that Americans have on that. But things like no cost contraception, no cost PrEP, the pill that helps prevent HIV transmission, these are things that have been attacked by conservative groups and are brought up in Project 2025 as well. Trump himself has not been specific about wanting to do that, but I don't think he would get to that degree during an election campaign. I think it's going to be who he puts in place at CDC who would then follow through on those things.
We have a question from Aparna Zalani. How would RFK Jr. impact healthcare in the Trump administration, especially given his anti-vaccine stance?
Yeah, so I think this morning he was named to the transition as well. So he did already put out there that he wants to have a public health role, if not HHS secretary, then some sort of public health role focused on chronic disease in the White House. He has in recent years, sorry, my cat keeps returning. He has in recent years tried to talk about his vaccine concerns embedded in this idea that we have rising chronic health issues from autism to learning disorders to allergies to gastrointestinal issues. He wrote a book last year that underscored that. And we do know from leaked audio that he's talked to Trump about these concerns as well. And Trump is not opposed to the rhetoric that he's using. So I think that it would be a very big issue, more erosion of the confidence that we have in vaccines, then probably also more funding of studies that seek to link these chronic health issues with vaccine scheduling. And we're probably going to see, if this does happen, rolling back or softening of vaccine schedules or requirements, and just sort of more scrutiny of public health leaders, both past and present.
Yeah, thank you. And we have a question from Nancy Spears. She says, my question for the panelists is twofold. How far does the healthcare section of Project 2025 extend into the rights of youth, particularly at-risk youth, those in minority marginalized groups, and especially youth in foster care? For example, with the CDC tracking abortion data, does that include tracking young people's bodies and or access to birth control as well?
The birth control question, yes, to a degree. It seeks to not quite limit all forms of contraception, but in particular Plan B, which it calls an abortifacient, which means that it's sort of a tool for abortion, which it's worth noting the FDA said in 2022 very clearly it's not. But with regards to talking about foster children or at-risk youth, the times that Project 2025 has talked about that, it's talked about the Association for Children and Families, which oversees foster programs, and largely talks about within that sort of the same rhetoric that we were talking about earlier with Biden administration policies, in their view, promoting abortion and promoting gender identity politics. And so they're talking about overhauling the ACF resources for those things. That's the main way that Project 2025 has talked about this. They haven't been as specific about what they would do with children and data tracking, but we can guess that if the CDC were to establish a tracker on, abortion or contraception, that would be included as well.
And Victoria and Drew, feel free to chime in too.
Well, just on RFK Jr., I think they won his votes. I'd be surprised if they put him in charge of anything, possibly in an advisor role, if anything at all. If he has votes to deliver.
Yeah. And we have a question from Susan Spencer. She says, can you address more how medical research and educational training, such as OB-GYN residencies, might be affected, and what might be some good story directions there?
Well, we've already seen some preliminary data, and I believe some of it's come from KFF, if I'm not mistaken, that there's been a slight decline in applications for OB-GYN residencies in abortion restrictive states. We've seen people leaving those states. That's more anecdotal, that there are doctors who are uprooting their lives and moving to other states. I personally know one who moved from Texas to Virginia because of the Texas abortion ban. So those are things I think we're going to continue to see play out. And I think that we can assume with that there's going to be heightened concerns about the related maternal and infant health issues. So if we have just more inequities, more maternal health care deserts, because people are either leaving those states or not applying for residencies in those states, could maternal and infant health outcomes worsen? And are people going to not provide the care that they should be providing because they are fearing penalties? And anytime that you can talk to doctors in those states who are struggling with those things or trying to navigate around them, trying to advise their patients on how to do this without them, say going to another state, I think there's lots of stories out there like that.
I will say also from the federal level, Republicans in Congress have tried to insert language into some of the spending bills on not banning federal funds from going to hospitals or medical centers that are training residents on how to perform abortions. It hasn't been successful in like going through because Democrats in the Senate will stop anything like that being stripped out. They'll strip that out of a spending bill, but it is something to think about if there is a GOP takeover of Congress. In the White House, that it is possible they could also ban federal funds for centers that do provide abortion training or attempt to do something like that.
We have a question from Malcolm Reed, who says, is it true that there are already over 300 executive orders in the queue that Trump can deploy if he doesn't get the House or Senate majorities he needs?
I don't know about 300, but I think what's interesting, I think what both Drew and Victoria have laid out pretty well is sort of the limitations that an executive order would have. For instance, I mean, Victoria said if there's a split Congress next year, there's going to be very little that can be done in practice. We've seen this with Biden as well, issuing executive orders, or even Trump in the final months of his presidency issuing executive orders. Sometimes they're just orders for an agency to explore something, and then, it doesn't really have legs. Biden, for instance, has issued them on improving mental health care resources, on changing the pay disparity between, cost disparity between behavioral health sources and physical health resources. Those things haven't actually happened yet. So you can issue an executive order and then nothing really happens. But if we wanted to look at sort of the playbook that Trump would have, we can look at the last few months of his first presidency, where he did have quite a few EOs that were, as Victoria alluded to, a lot of them had to do with drug pricing and changing the structure that we pay for drugs with. He could try to revisit those. But again, it's also a lot of these things are going to come down to Congress. And then also, not to overly complicate what we're talking about here, but the Supreme Court a few months ago issued a ruling that has massive ramifications for what the president can direct any of these agencies to do. So they overturned what's called the Chevron doctrine. That makes it much more difficult for agencies to act in any way that doesn't have explicit authority from Congress. And so this could impact in either a Harris or Trump administration what any agency can do at the request of the president, because Congress can say, or the courts can say, that's not in your purview. Congress has to specifically tell you that you can do that.
Yeah, and I think you can look at the student loan ruling from the Supreme, Biden tried to really forgive student loans from the executive office, basically. And then there were a bunch of court cases, and then the Supreme Court ruled he did not have the power to do that. So, he wasn't able to forgive student loans. That's something that needs to go through Congress, is basically what they said. So I think depending on what Trump tried to do from the executive branch, if it was a split Congress, it may also be tangled up in legal things, and courts may rule he does not actually have the power to do that. So executive, obviously there is some things you can do from the executive office, but it's not quite as wide reaching as you might think.
I think also, while this comment may sound weird to use a favorite word of the day, we really have no idea what a second-term Trump will be motivated to do. He doesn't have personal policy positions or really a personal ideology. He'll be surrounded by a bunch of people he appoints, but we don't know who they'll be. We don't know how influential they will be on him. He runs through people rather quickly. We saw that in the first term. Whether he will go hard right, mostly try and make money. The New York Trump will to some degree reemerge. I think we just have absolutely no idea. So yes, we can look back, we can look at what he said and all the different contradictory things he said. We can look back at his first term, but for somebody who just is so transactional and whose personal motivations are so opaque, I personally think it could be very hard to know, and in both directions, what you might call very bad or, less bad.
Yeah, no, I think that's a really good point. We can have all these plans by all these very ambitious conservative think tanks, but then you have the uncertainty of how Trump will really delve into policy, which has never been his.
He could just delegate to those folks and focus on what he cares about, which might be something altogether different in the second term or not. We don't know that.
Yeah. We have a couple more questions if you all can stick around for maybe another 5-10 minutes. So one is from Vinuri Sirawardani, and I hope I'm pronouncing your name correctly, asking if Trump is elected, how could cities that have passed sanctuary city legislation around gender-affirming care be affected by his administration's attempts to restrict access to this care?
I can take that, and I've abandoned the efforts to get my cat off the desk because I think it'll just be easier if she sits here. But with regards to sanctuary cities, there is an interesting question there because Trump has said that he would seek to ban any federal funding going to any type of gender affirming care, and once again, regardless of age, which would be a major step and would likely need congressional language. And as we talked about earlier, there were attempts by House Republicans to insert that into last year's budget, and it didn't go through. So it would take steps. It wouldn't just be, for instance, an executive order. It would take more steps than that. For sanctuary cities, then the question is, how much of their gender affirming care and their resources for people are tied to federal funding? And there is a very big question there. We don't actually know that. When I've spoken to people about it, about how many people who are transgender or seeking gender affirming care are on Medicaid or Medicare, they've told me minuscule numbers, like it's 1%, if that. And that matches up with, the amount of transgender people in the population in general. It makes sense that there'd be such a small number, if it exists at all, in any of these programs. But that would be the question for those sanctuary cities is how else are we going to finance this and continue these resources for people? Also, probably, if anything like that went through, we could see lawsuits from those very cities or from the organizations that protect transgender people. So regardless of what route Trump seeks to take, if he has a second administration, and we're probably going to see extensive legal challenges, and it could very well go up to the Supreme Court, like all these reproductive rights cases have. And then we're back at the question of how much can the federal government, or how much, I should say, can courts dictate what healthcare practitioners do, which really is kind of the theme of all these things we've been talking about.
So, the details matter, and a 900-page document is pretty daunting, not just for the public, but certainly for journalists. So we have a question asking about what newsletters or other resources folks can keep track of to really be looking at some of the granular details about Project 2025 that end up having broader implications, particularly, and the GOP platform, as they affect access to healthcare and the legal rights of seniors and people with disabilities. Did folks have any suggestions for that?
There's a bunch of
like all of our news outlets, probably.
exactly. There's a bunch of good ones, and some of them are free.
Yay.
Drew gets to dig in there.
Ah.
The adults with disabilities question is a good one, though, and I don't think that that Project 2025 at least engages with that very much. I would say that as much as Project 2025 engages with potential discriminations, it wants to narrow the definition of what discrimination is. So it wants to, of course, as we've already talked about, remove discrimination on the basis of sexual preference or gender identity, but also, and once again, Roger Severino, the man who authored or primarily authored the healthcare section, was the head of the Office of Civil Rights in HHS in the first Trump administration, so he oversaw a lot of this. They think that Democrats have gone too far on what is considered discrimination and what is considered equity, essentially.
And again, I wouldn't get too carried away with 2025.
Yeah.
It's one of many. It's not that it's unimportant, it's really important, but it is one of several.
Yes, absolutely. And Trump, to that point, has not engaged with this at all. And I don't expect that he would before the election. It will, as Drew said, count a lot on who he appoints to these different areas and what their priorities are and how close they are to, his ear.
And if you wanted to read just the HHS section, it's not like, I mean, it's long, but it's not like overwhelming. So I would say like it's obviously a 900-page document, but there is only an HHS section, So if someone wanted to see just exactly what it said, I think it's not too much to. I've read it a while ago, so.
I'm just going to take two more questions here. I'm sorry, was somebody else going to say something? Oh, Bradley Craig asked a kind of reality check question here, which is, won't executive orders lead to litigation that clogs up the process and slow down any changes that executive orders are trying to make?
Sarah kind of addressed that.
Yeah, the short answer is yes. Executive orders can tell agencies to do something, but then the agencies have to try to do it. And either Congress will step in and say that's not in your purview, or Congress simply won't do anything to give them the funds for that or the authority for that. And then the litigation question, as you said, I mean, it's just not a very efficient way. An executive order is not a very efficient way to get things done. You kind of have to have Congress at least somewhat bought in.
Some of the executive orders are for political effect.
Mm-hmm.
I have asked my agencies to do A, B, C, and D and work together on something else, and that's all they are.
Yeah. And do you expect a more favorable legal climate for policies like Medicaid work requirements under a second Trump administration?
Oh my God, yes. And even more serious things. We don't have time to talk about how work requirements actually work. More serious steps like time limits. I mean, limiting the amount of time a beneficiary can be on Medicaid to 3 years is a very serious policy step. And this is one of the challenges for all of us and for health journalism, the challenge of proportionality. What's a small policy step that might make a grabby story and is understandable? And what's a policy step that really could affect tens of millions of people and is hugely important? And they tend to come out sometimes sounding like the same. They're not the same. So things like that, the time limit, a Medicaid block grant, per capita cap, Medicare premium support are of an order of magnitude entirely different from the other stuff, as are, for other reasons, some of the abortion and reproductive health issues we've been talking about.
And there certainly is support for work requirements among congressional Republicans. I will say, I meant to mention during my overview, but ran out of time. But another big thing that's going to happen beginning of next year is that we're going to reach the debt limit again. And so Congress is going to have to address that. And one of the policies that they floated, House Republicans floated when Kevin McCarthy had to negotiate this in 2023, were implementing Medicaid work requirements. And at one point that was being considered in the debt limit package. And then it got thrown out. But it was that was last year. So Congress certainly has supporters on the Republican side for work requirements.
Turns out work requirements aren't really about work, but that's a whole other discussion I don't think we have time for at this point.
Well, I want to thank Drew, Sarah, and Victoria for their really excellent insights, and to the audience for all the great questions. We'll be emailing you a survey asking for your feedback on today's program and for your ideas on other topics of interest. Please do take a moment to complete it. We also urge you to help support these webinars, so you can find more information here on how to do that. We'll be archiving this webinar a little later today at centerforhealthjournalism.org. I also want to thank my colleagues who helped make this webinar possible: Ryan White, our content editor, and Abs Mandar Bishu, our communications strategist. Thanks so much for joining us, and have a wonderful day.
Thank you for having me, guys. Great questions.
Thank you.
That was great.